Hello, Suzanne Connors-Inc with Dawn Visions Hypnosis here to ask you if you are arguing for your patient's mental illness more than you are helping them to be well. This is a sincere concern of mine because all too often what I found while I was working in conventional mental health was that the diagnosis was the main thing. The pathology was the main thing. And to my mind, it's rather impossible to help a person heal if it's always about the pathology and the illness. I have found in my hypnosis practice that one can actually help their clients to overcome the symptoms that got them diagnosed in the first place. I know, isn't that unbelievable? You see, our thoughts create our behaviors. And we understand why a person is thinking the way that they are. We can help them shift their behaviors. So, in neurolinguistic terms, it's all about understanding how the subconscious mind has created the internal representation that has created this dysfunctionality. So we have 5 senses. The 5 senses go into our subconscious, unconscious mind, where we are going to delete a whole lot of it, because if we didn't, we'd be insane. This is going to help us to basically distort a lot of the memories in terms of how they're remembered. This is actually Virginia Satir's work, one of the people that Bandler and Grinder had studied when they developed the techniques for neurolinguistic programming. Now, those memories end up going into our internal beliefs and attitudes, which create our internal representations, which is how we understand the world around us based on the way it was coded whenever the negative event happened, because our patients and clients don't end up with dysfunctional behavior. If it was something positive, it's usually a negative event, usually trauma of some sort, and that becomes the behavior. What we do with neurolinguistic programming is we shift the behavior by shifting the internal representation where all the internal representations occur, which is actually in the emotional mind, the amygdala and the hippocampus of the brain. And it works really well. I can tell you I've helped to heal those with anorexia so long as they were at a healthy weight. I can't work with people who are not at a healthy weight, but a lot of these folks still have a lot of dysfunctional thinking, and they need to learn how to have appropriate boundaries. So that's the work I do with them. Bulimics, many came to me because they were really fearful of doing irreversible damage to their gastrointestinal system. They didn't want to have that happen. And sex addicts who are sick of the shame and guilt and wanted to get over it. And a few of them came because they actually wanted to get into healthy relationships. And over the years, I'm really happy to report that the men who actually completed the program with me did actually get back together with their families instead of running off to have what we would say would be very, I don't know, they would say that they didn't really get much out of the sex other than the sex itself. It wasn't meaningful at all. And that started bothering the guys who came in to see me to have that problem eradicated. And I had quite a few who actually learned how to have really happy relationships and got married and are still married. I see their stuff on LinkedIn. It's really quite amazing. And then, of course, many people with depression and other people with anxiety, and some people with depression and anxiety, and then OCD as well. All these people can be helped with these tools and techniques if you actually understand how to utilize them in a way that will help the client overcome their problems. I know I've been doing it for 20 years plus, close to 21 years now. So if you're interested in learning how to do this, I do offer a 2-day VIP program You can do it in a Saturday and a Sunday. And it's all done online, one-on-one. And I have a 12-month mentorship program, which is really special because I don't know anyone who teaches hypnosis or non-linguistic programming, otherwise known as NLP, who offers that anymore. This is actually what I was offered when I did my non-linguistic programming training, both prac and master prac level, and it really helped a lot. And I know that you guys understand this because you went to clinical to learn how to work with your patients, right, under supervision. So it's the same thing where you'd be able to go through the 2-day training, and then as you're working with your patients and you have questions, you just message me and then we set up a time for a video call and I help you to figure out exactly what you need to do in the order that you need to do it so that your patient can let go of whatever the problems that you need helping them let go of. It's something that my trainees really truly love, and I'm really proud of the work that they're doing. And my mission is to teach as many of you mental health professionals how to integrate this work into your healing process, because you'll be able to help a whole lot more people instead of just managing symptoms, really help them overcome their problems. And you can actually get paid a whole lot more for doing it in this way because people want to be healed. They don't want to be on meds for the rest of their lives. They don't want to be seeing a psychologist, psychiatrist for the rest of their lives. Really, most of them do not. What they'd really love is to have their freedom back. And that's what you can offer. And you can charge $5,000 to do a program like that with them once you understand how to use these tools and techniques. And you don't have to worry about insurance because insurance doesn't cover this work. So you're looking for people who have the income to be able to pay you what your treatment is actually worth to them, to give them a whole new life without all the previous problems. So I'll leave my contact information below in the description box, and you can get in contact with me and we can set up a time for you to have a video call and see if there's something that you want to pursue. That's all I have for you for today. As always, I thank you for spending your time with me. Till next time. Bye-bye all.